My name is Oana Basciano. I'm studying health and social care, and today we will talk about elderly, which means elderly care is defined as health, personal, and social care for people aged 65 and above, but age does not dictate the support required. Other adults are quite independent, but still others can be dependent due to their weaknesses, dementia, chronic illness, lack of mobility, or changing family situation. The main aim is to maintain health, dignity, independence, safety, and quality of life in line with the well-being principle of the Care Act 2014. The care can be provided in a variety of environments, such as home, community, services, residential care, or nursing homes. The most suitable environment must be determined depending on estimated needs, individual desires, risk, and available resources. Care demand is rising to the aging population in the UK, shortage of workforce, inequality by region, and the ever-growing intricacy of health conditions are factors contributing to this pressure. So, elderly care cannot be considered solely as a practical help. Quality care should acknowledge the totality of the person, engage these people in decision making, and help them in meaningful control of their daily life. This process assists service in safeguarding rights, even as they address evolving needs in the later phases of life in a respectful, sensitive, and compassionate manner. So, elderly care is about how to treat the elderly people, how to treat their needs. This is how we can call elderly care. So, elderly care is about the elderly people.
I'm going to talk about why old people seek care. Some elderly adults seek 24/7 regular nursing attention due to their complex medical conditions such as advanced dementia, arthritis, heart disease, and cancer. This is to help with everyday living activities due to their long-term medical conditions. This could be because of poor memory, loss of thinking, also having a disability. This is also to prevent falls and injuries, and to support them with their safety. And also it is to prevent loneliness, as some elderly people don't have the family support. This is why older people go into care homes or have carers come to their home. And obviously in the care support system, we can help with the facilities that they need for the safety, like equipment, also managing the medication, the food, giving them food, and just supporting them in every way that they need supporting, down to their long-term medical conditions.
So the role of care workers is to provide support and assistance to any individual who require help, whether that's because of their age, illnesses, disabilities, and the objective is to enhance their quality of life and give them a level of independence. Wide range of roles to do that on a daily basis and on a care basis is assisting with daily bathing and personal care, dressing and grooming, maintaining personal hygiene. There's the management of medication, making sure individuals take the right dose at the right time of any prescribed medications, and also keeping an eye out for any side effects. There's cooking and preparing food and drinks that not only meet the dietary needs but also the preferences of those individuals in your care. Providing companionship and emotional support to help combat loneliness and promote mental well-being. There's the assistance in mobility for anybody with mobility challenges, using maybe mobility aids such as hoists and chairs, and also assisting with transportation to medical appointments and community activities, or just general days out to enhance their daily life. And then general light housekeeping, so performing household tasks, keeping places tidy, cleaning up, doing some laundry, just to help maintain a safe living environment for those individuals. And then we look at the elderly abuse, which is any intentional act or failure to act that gives or creates a risk of harm to an older person. This is often perpetrated by someone in a position of trust. Mistreatment can occur in homes, in the family homes, care facilities, community settings, and it's very important that we recognise that these come in various forms. So there's obvious physical abuse, as actual bodily harm, either through hitting, pushing, maybe restraining or wrongfully using medication and equipment. There's the emotional, psychological abuse, so that can be verbal or non-verbal actions that cause fear, distress, threats, insults, humiliation, and just social isolation. Financial abuse comes in the form of exploiting money, property, assets. That can include fraud, theft, maybe even coercion. Sexual abuse is any non-consensual sexual contact or exploitation. It can include forcing an older adult to watch sexual acts. And then there's overall neglect, which is just the failure to provide essential needs like food, water, shelter, hygiene, the medical care.
So here I will discuss about the benefit of providing elder care. The principal benefit of providing elder care is to ensure safety, comfort, satisfaction, social engagement, and better quality life of older adults. It also has some key benefits, which is personalized daily living tasks such as moving, eating, hydration, dressing, cooking, bathing, washing, cleaning, and shopping. The older adult care users seek for their personal practical support to manage their compulsory living tasks due to their complex health condition, illness, and age-related health condition. Normally, domiciliary care or home care, residential care service provide this kind of services. Secondly, we can say ensure security and safety, which is emergency call system for quick response for any emergencies, handrail, step-free access, and wider corridor to reduce risk of accident. Residential home normally design a safe and secure environment where the service user can be more safe and secured. Thirdly, we can say medication assistance. So the right doses of medication on the right time by regular supervision, which avoid mistreatment and life threat. Emotional companionship. Elder care service provider offers different fun and engaging activities such as gardening, exercise, exercise class, gossiping, and joking, which reduce service users' loneliness and improve their mental health. Specialized care could be another benefit, which is specialized care means nursing home care provide qualified nurse for 24/7 by regular nursing attention for complex medical needs such as advanced dementia, and achievement of elder service users full satisfaction could be another benefit. The next is challenges or barriers of providing elder care. The first we can say enormously shortages of staff. In recent past year, it is being reported 165,000 unfulfilled vacancies in this sector for aggressive competition and high turnover from NHS and other organizations. Secondly, we can say fragile social care settings, which is long hours and low pay, creating massive gap in staffing, which lead to care sector closing, struggling, instability in care sector systems. Thirdly, we can say limited access of receiving publicly funded care, which we know in the UK, the people with lowest assets and highest needs are entitled to receive publicly funded social care, and on the other hand, for others is out of pocket cost for residential care, specialist care, and medication. The another challenge is inadequate time limit to provide quality care, such as 15 minutes care visit. In home caregiver normally struggle with their travel times and complex schedule, which lead to rush receive. For example, for a domiciliary care provider, 15 minutes rarely enough for feeding, washing, dressing, and review complex care of a service user. Geographical distance could be another challenges, because some of the service user lives in a place where care service is not enough available for them, so that could be a reason. Then communication and language can be another challenges, because care service provider need to understand the service user needs, and that's why the communication and language is very important. And for that reason, there is enough shortage of entrepreneur. Non-English background is the problem, and shortage of sign languages.
My name is Sandra Barra, and I will be going over the laws and policies for elderly people to ensure their safety and well-being while they are in care. So the First Care Act 2014, it is a UK law, and it sets out rights and responsibilities of local authorities, care providers, and service users in relation to their care and support. So it assesses people's needs and their eligibility for the publicly funded care. It promotes well-being. It introduces the national eligibility for the publicly funded care, and it safeguards and strengthens against elderly abuse and neglect. For example, there's an 82-year-old man, and he is struggling to wash, cook, clean, and dress himself due to arthritis. Under the Care Act 2014, his needs will be assessed, and if he's eligible, a care home worker might be arranged to help him with his personal care, to provide meals, or to help make sure that grab rails may be installed to help him live independently at home. The next one is the Mental Capacity Act 2005. It protects and helps individuals who may lack the capacity to make certain decisions regarding their health on their own. So the Mental Capacity Implementation Program, MCIP, is a joint government program between the Ministry of Justice, the Department of Health, and the Office of the Public Guardian and Welsh Assembly Government. It was established to help launch the Mental Capacity Act. So it ensures that you are involved in the decisions that directly affect you. It promotes the right for an individual to make their own decisions. It provides guidelines on decision making for those who are incapable or lack the capacity to make their own decisions, and it emphasizes the importance of acting in the best interest of the person if they can't make their own decision. This applies to elderly and certain illnesses because at that age, sometimes you don't have the mental capacity or the memory to be able to make your own decisions. So you're going to need someone to help you make these decisions. The Equality Act 2010, this one strengthens and consolidates protections against discrimination in the UK. So it legally protects people from discrimination in the workplace and society based on things such as their age, gender, race, or disability. It promotes the equality of opportunities such as employment or education, and for the disabled individuals so they feel equal and have equal access and participation. For example, an elderly woman with a cane wants to attend a day center for social activities. She cannot be turned away simply because they think she's too frail. They must provide reasonable support and mobility assistance to make her feel included. Health and Social Care Act 2012, it aims to improve the quality and the efficiency of health and social care services by reorganizing the NHS in England to be more efficient, transferring commissioning funds to GPs, and establishing new agencies. So it increases competition among providers for the better service and the best efficiency. It gives patients more control and more choices when it comes to their care options. For example, there's an 86-year-old woman with dementia, diabetes, and mobility problems. She will probably receive care from her GP nurse and social worker, and maybe a physiotherapist. So all of these will work together to create a personalized care plan that will support not only her health, but also her safety and independence. Thank you.
In this part, I am presenting improving elder care quality. So, how to improve elder care quality is we need to make sure enhance staff training, address symptomatic challenges, combat isolation, and promote holistic well-being. Provide outgoing education for care workers to ensure they can deliver effectively. Activity work to resolve industry barriers such as critical staff shortage, rising cost of the care, and long NHS waiting time. Combat isolation, improve mental health outcomes by developing inclusive programs that especially target loneliness among other population. Conclusion: elderly care supports the health, dignity, and independence of people aged 65 and over. It covers mental, emotional, daily living, and nursing needs across different care settings. Laws like the Act 2014 and Human Rights Act 1998 protect elderly people's rights.